Hi, I'm Dr. Kandola. I'm here at my Cardiff Clinic, Skin Enhanced Aesthetic Clinic, with Gemma Hill. We're going to have a chit chat about a few treatments that Gemma would potentially like to have. So Gemma, what sort of things are we looking to improve?
Just want to look really fresh, really.
Yeah.
Hopefully get rid of a few lines up here. I've definitely got some lines in between my eyebrows here.
Okay.
I want to get rid of, plump up the lips a little bit.
Yeah.
And just look quite fresh.
Yeah. And how long have you been thinking about having a treatment now?
Oh god, a couple of years now.
Yeah.
I'd say about 4 or 5 years probably.
Okay. And what do you know about Botox, for want of a better word, the treatment we're going to do to relax the wrinkles in the upper head?
Just that, well, to be honest, just that it obviously works. I've had a lot of friends who've had treatments done, Botox, etc. And I've seen them before and after and noticed the difference.
Great. So in terms of the wrinkle relaxing treatment, the injection with what we usually say is Botox, so it generally lasts around 3 or 4 months, kicks in after about 5 to 10 days.
Okay.
You may notice some of the wrinkles are still present after having had the first treatment, because this is your first treatment with the Botox or with any wrinkle relaxing injection. So you may well need a little extra top up. Okay, so we'll do that after 2 to 6 weeks after.
Right.
And that'll be it really. It'll last around 3 months, as I said, and then you just come back and sequentially have a few treatments as and when you see the lines reappear.
Okay.
Generally try and improve the ever so slight hooding we've got here, just by increasing the dose of the tail end of the eyebrow layer to give you a bit of a lift as well.
Brilliant.
If you don't want that, I won't do that.
No, that sounds good.
I just tend to do that as a sort of standard thing for most people. And in terms of what you said in the lower face, there's a few options. Using dermal filler. So I know quite a lot of your friends have had that.
Yeah.
But just wondered if you knew any more about the treatment itself.
No, not really, to be honest.
Okay, so as with the Botox, obviously there's injections and they could bruise. But once the dermal filler's in, it will last around 6 to 12 months depending on the area we're going to treat.
Okay.
So in terms of the lip area, we're going to use a nice soft product, and as a result of it being slightly softer, it's going to last around 6 to 8 months.
Okay.
We're going to use Intraline 2. Okay. And for the nasolabial lines, the ones that go from the nose to the edge of the mouth and from the mouth to the chin, the marionette lines, we'll use Intraline 2 as well. That will last probably around 12 months in that area. It's comprised of hyaluronic acid, just like in the skin creams, but it's really concentrated, so it attracts water to the area, so it plumps out the area really nicely. Don't have to put in a huge amount to achieve what we want to do, and as a result, it should be a relatively kind of straightforward and quick procedure for you. Do you have any questions about that?
No, sounds brilliant. Yeah.
Alright, fine. I tend to use a dental block when doing the lip enhancement.
Okay.
So you'll be nice and comfortable as well. I think before you mentioned something about potentially under the eye area.
Yes.
So that's something called tear troughs, and that's something we can talk about in time.
Okay.
But to get that done, I tend to use a blunt-ended cannula. So it's not a needle,
Right.
and as a result, there's less bruising than would otherwise be the case with a sharp needle.
Okay.
And it's potentially a little bit safer as well. In terms of safety, obviously we've talked about how to do the treatment.
Yeah.
Just wondered what you knew about some of the risks involved with dermal fillers, because as with anything, it's not risk-free.
No, of course. Well, I've heard some bad stories, obviously, in the press and things. I've heard there can be drooping, there can be headaches. There loads of different.
Okay. In terms of, that's definitely the case in terms of the Botox treatment.
Sorry.
That's all right. We'll chat about that as well. So starting off, I guess, as you raised it with the Botox, there's drooping potentially, and that's over treatment of the forehead sometimes. That can last up to 3 months. Okay, generally wouldn't, and I can do a couple of treatments if it did happen to try and minimise it. Really rare would be eyelid droop, so that's when the eyelid closes. Touch wood, that's not happened yet, but if it did happen, it would last 3 months, the duration of the Botox. The more common things would be, as you said, headaches. So it doesn't happen very often. Maybe, in my experience, maybe 1 in 40 or 50 people get quite a nasty headache after, and it can last up to 3 days. It does just go, and when it's gone, it seems that if you have another treatment afterwards, it doesn't come back.
Right.
I don't know why, particularly, Must be the muscles getting used to being paralysed. In terms of the dermal fillers, the things that potentially could go wrong, if you like, are, and this is in spite of taking all the usual precautions, are infection and bleeding. So that could lead to bruising. Bruising is quite a common one, okay, and especially swelling in the lip. So it can swell up to 50%, maybe even 100% bigger than the final size it's going to end up at, and that will happen after around 2 or 3 days. We minimise that by using lots of ice.
Okay.
And that'll help bring down any sort of swelling that's happening over the first 6 to 12 hours. Rare things would be lumps and bumps. Minimise that by obviously using the correct product in the correct area, which we're going to do, using good technique, and also not putting in too much in one go. So we're just putting in a mil in the lips, which is not a huge amount, and we're just putting in a mil in the nasolabial and the marionette lines, which is again not a huge amount. If they were to happen, we can reverse it using something called hyalase, which is a drug which dissolves hyaluronic acid, and that will, I'll go through that in detail before using it, but there is an option. Okay, so it's not permanent what we're doing. The more serious end of the spectrum there would be vascular occlusion, so that's when a blockage happens to an artery, and that would be due to a fragment of dermal filler, or to compression due to some of the swelling of the treatment. Now that commonly occurs, when it does occur, it would be commonly up here around the nose area. So things to watch out for would be paleness of the skin, or redness of the skin, or just a strained sensation over the skin. And of course I've run through that all before you go. And if it does happen, it is treatable, but it is definitely an emergency. Okay, so usually we'd realise before you left, but rarely, you might think, hang on, what's this? In which case you just ring the number I'll give you,
Okay.
and I'll see you sort of straight away and reverse the product. Okay, that's kind of like the flight safety announcement. So that's not, that shouldn't happen, but we know what to do if it were to happen. Okay, so there's a lot of info there, and I know you've read through the forms and stuff like that, and had some time to digest. I just wondered if you got any questions about that.
No, I think it's quite straightforward. Yeah.
All right, good. Well, we'll get on to it then.
Okay, brilliant. Thanks.
Cool. So just a little bit of a pinch in the middle here for the frown, bit of a scratch. Scratch again. And squint a smile for me. And relax. Okay. Alright, pop your head this way. Going to pop that injection at the tail end of your eyebrow, just to really give that nice lift. And again, a little bit of a scratch now. Going to come round onto the arch of the cheekbone there, just to make sure I catch some of the lower bits of the orbicularis oculi muscle, so they can really help with minimising those wrinkles that start creeping under the eye. Okay. Now raise your eyebrows for me and relax. That's fab. And again, and relax. And again, and relax. That's great. Ruffle your nose up now. These are what's called the bunny lines. Just pop 2 tiny little blebs in. One there, and one a bit further up. And the same again, we scratch. Little bleb there and one slightly further up. There you go, how are you doing?
Right.
Oh cool, so the way I mark, we're going to put the cannula is I sort of draw an imaginary line from the lateral border of the lateral canthus of the eye down to just where the arch of the cheek is. Put a little introducing needle in there and then put the cannula through that. We're going to use interline 2 here because we're going to do a sort of lower dermal linear retrograde cannula technique for the augmentation of the cheek area. Just make a nice little hole there. Okay, just going up to where the pupillary line would be. When I do this angle here for the cheek, I tend to aim for kind of just shooting above the ear, which generally follows where the arch of the cheek is, cheekbone. So just look to your left hand side a wee bit, and you can see the placement of the cannula just under the deep dermis there. I'm going to pop in probably 0.05 to 0.1. And then I'll just fan around and put the same in slightly lower to it. Okay, so once that's done, put a wee bit of pressure on there just to help it become slightly more uniform and less thread-like. How are you feeling, Jen?
Yeah, fine, thanks.
And you can also feel for any lumps or bumps, of which there are none. Okay, so look in the middle there. You can see quite a subtle augmentation on either side, on the right hand side. Same marking, lateral canthus down to the arch of the cheekbone. Again, aiming to just shoot up to above the ear there. I tend to use three fans if we're just doing the cheek. That's usually enough, and then one come immediately. Okay, alright. So that looks pretty even there. Good. And in this position, if you're using a cannula, you can actually reach down here.
Okay.
So I'll pop another interline 2 on and show you how to do that. To actually come down to the nasolabials there, do some cannula work like that, and also into the marionettes and just under the corner of the lips as well. Obviously done through one entry point, which minimises some of the trauma to the area. And I always start off doing cheeks first, because then you can see how much lift you get in the face and kind of rather than overfilling lower down. So there's the end of the cannula just there. So I tend to do probably 4 little injection points here. And another maybe 0.025 there. Okay, you doing alright there, Jem?
Yeah, thanks.
Cool. So when I come out of that tract, because there's a few bits of connective tissue, you can't easily get from there straight to there, so you have to come back all the way and use a slightly different angle. And the good thing is the layer that I'm going through doesn't have a huge amount of vascular tissue in it. Obviously everywhere's got blood supply, but as long as you don't have some of the big arteries and veins, it's pretty straightforward to minimise some of the bruising. Okay, there's the tip of my little cannula. I'll just feed the tissue onto it. And again. And again. And try and sort of come round the edge of the mouth just to pick up the corner of the mouth there. There we go. And often if you want to get the cannula around a corner, it's a bit counterintuitive, because what you think you should do is go, oh, I want to go that way, so I'll go like that. Yeah. But actually the cannula bends like this, so you end up shooting off down here. Yeah. So really the thing to do is, I'm just there at the corner of the mouth, the thing to do is go like this, and just bend it round as it goes in. So we're now here, right, which is perfect. Yeah. So put some of that filler around, and then take the bend off and come straight down here. Okay, and smile for me, and relax. So probably that's enough filler after this little blow. The benefit of doing it like this is you kind of pull the corner of the mouth up. Yeah. Now in Gemma's case it's quite easy in a way, because she's got such elastic tissue, because she's got a good skin. Yeah. But when you're treating someone who doesn't have as good a skin, you probably want to do an entry point down here as well. Yeah. And then you can come up like that. Okay. And what that does is kind of reinforces what you're doing there. So we've only used 1 mil, right, to do nasolabial marionettes and a bit of a flick at the edge of the mouth. Yeah. So with a 2nd mil, in someone who needs more, using this approach you can cross hatch it from a bit of a scratch there. So you need to watch out here for the facial artery. If you clench your jaw, for me, this is the masseter there. Now the facial artery is here. So if you're a bit absent-minded, you just accidentally pop the needle in near there, you can actually get quite a significant hematoma, which actually might not even be apparent immediately, because it's quite deep. Yeah. So it might only manifest as like a spreading bruise all the way down the neck, about a day later. So you'd be quite happy at the time, and then you could end up being a lot less happy in a couple of days. Put your chin in the air there. Okay. So this is just to reinforce the lower border. Good. A little bit lower down, so 2 or 3 cross hatches there is usually enough for anyone. So it'd be quite, you're the sort of patient that could actually end up with significant bruising if we use sharp needle everywhere, because as you can tell we're treating multiple areas. Sorry? There we go. Same again. So just going to outline the vermilion border, just above, just kind of outside of the actual lip itself. Bevel facing up for this. And pop your head towards me. So bevel facing up. There we go. Back into the middle. I'm going to do a little border of your lower lip as well, and then see where we are in terms of where the extra volume needs to go. So in terms of the injection points, obviously you've got the infraorbital nerve coming out just here, so I tend to try and mark that there. Pretty unlikely to damage it to any significant extent, but it's quite uncomfortable potentially. Put a dot on this side. And you can see your injection points are probably north of there anyway. So if you pop your finger there, you can feel the inferior orbital ridge all the way around there. And so what I tend to do is I'll get you to look to the ceiling, Jem, and that kind of brings it out nicely. And obviously with gloves on and having cleaned it, I'll feel where the bone is and then slide my thumb down a bit. And I know that the injection point's going to be just above where my thumb is. And then I've kind of locate it quite accurately. That's if we're going to use a sharp needle technique, which we will do. The cannula technique, I just come in through the same hole I've made there.
Yeah.
Come up here, deep, like underneath the orbicularis oculi, all the way up here, and then do a retrograde injection there. And then you can, if this entry point here was actually here, then you could come around here as well. But you probably have to make a second one in this case.
Okay. Deep breath in. Deep breath in.
the way, isn't it? Keep doing that. Sorry.
Mm-hmm.
Go.
Basically feeling pretty lumps or bumps, you know.
Mm.
Not even any bruises, apart from the Botox that I managed. Alright, well then. Do you want to see the final result?
Amazing. Thank you. Thank you.
That's
very
alright.
much.
Pleasure. You get those pictures on the... hi, I'm Dr. Kandola here at the Skin Enhance Aesthetic Clinic in Cardiff with Gemma. So we've just done a few treatments here just to run through them. We start off with obviously 3 hours Botox, which haven't kicked in yet, and then we've got the Liquid Facelift, which involves a cannula technique, entry point here, fanning a few times lateral, once medial, with the tear troughs as well. So that's good for sort of grade 2 or 3 tear troughs. And then from this entry point I use the cannula technique to soften out the nasolabial lines and also the marionette lines here. And then to finish off everything, we did some lip augmentation. And I think I'm right in saying it was relatively pain-free.
Yes, surprisingly.
Yes, surprisingly, fortunately. And luckily everything's looking really good afterwards.
Yeah, really happy.
So excellent. So doing the liquid facelift today, I've been using Intraline 2, which is a relatively deep filler, and then complementing that, I've used Intraline 1 in the lip border and also in the lips as well. So you generally expect a lifespan of about 12 months for the cheek and the tear troughs, and for the lips we're looking at about 6 to 9 months.